Hello guys, so let's start discussion about one group of antibiotic which are protein synthesis inhibitor. Protein synthesis inhibitors. So let's start this with the names of some protein synthesis inhibitor. In number one, it is aminoglycosides, macrolides, tetracycline, chloramphenicol, clindamycin, linezolid, and streptogramins. So these are the names of antibiotic which comes under protein synthesis inhibitor. So let's learn about its mechanism of action. Before learning it, we need to know about the bacterial protein synthesis process. So let's learn about that. From that, we learn its mechanism of action. So the process of bacterial protein synthesis occurs from DNA. From DNA, with the process of transcription, RNA is formed. So for this process of transcription, RNA polymerase is required, which is the target of rifampicin, another group of antibiotic which is used in TB patient. So it is the target of rifampicin. From RNA, with the help of process of translation, protein synthesis is inhibited. So the process of translation is inhibited by this group of antibiotics. So let's learn about a little bit about process of translation. From messenger RNA, 50 units and 30 subunits of ribosome is required. Then tRNA is added. From tRNA, the peptide is added and protein is synthesized. So this process of initiating this process is inhibited by aminoglycosides and linezolid. And the process of adding tRNA, as described earlier, is inhibited by tetracycline. And the process of adding peptides and translocation, it is inhibited by chloramphenicol, macrolides, and clindamycin. So let's start with one group of drug, that is aminoglycoside. So some examples of aminoglycosides are gentamicin, neomycin. These are all drugs under aminoglycosides. Amikacin, tobramycin, and streptomycin. So let's learn about its mechanism of action. So as we have already discussed earlier, this aminoglycoside block the initiation of protein synthesis. So they block the initiation of protein synthesis by binding to 30 subunit of ribosome. So due to by binding to the 30 unit of subunit, it causes misreading of genetic code. Misreading of genetic code. Due to this, bacteria cannot divide bacteria cannot divide and produce cellular protein. As a result of this, it causes cell death. So this is the mechanism of action, detailed mechanism of action of aminoglycoside. So, and it requires oxygen for transport into the cell. For transport into cell. This is the reason why it is not effective against anaerobic organism. So it is not effective against anaerobic organism, as well as it does not affect eukaryotic organism. So that's why it will not inhibit the protein synthesis of our body. It will only synthesize the protein synthesis of the organism, because we have different ribosome. So it will not affect our body protein synthesis process. And it is also not transferred into eukaryotic cells. So it is also not effective against intracellular organism such as rickettsia and chlamydia. So these aminoglycosides are used alone rarely. They are used alone rarely. Let's talk about uses. So they are used alone rarely to treat some serious gram-negative organism infection. To treat some serious gram-negative infection. We all know that streptomycin, one of the drug of aminoglycoside, is used to treat TB in combination with other drugs. Similarly, neomycin is given prior to bowel surgery. Because it inhibits the absorption, because it is poorly absorbed. This drug is poorly absorbed, so it stays in our gut for longer time. Stays in gut for longer time. It is often given with this neomycin is often given with erythromycin. So these are this group of aminoglycosides are often combined with beta lactamase. Why? Because they have synergistic effect. So their combination is more effective. So combination is more effective. So let's learn about some of its combination. So vancomycin plus gentamicin is used for endocarditis, and ampicillin and gentamicin is used for in newborn meningitis, and piperacillin tazobactam plus tobramycin is used in cystic fibrosis because it covers pseudomonas. So these are the combination of aminoglycosides and beta lactamase which are clinically used. So let's learn about the adverse effect of aminoglycosides. So the most common side effect of aminoglycoside is ototoxicity. It is toxic to eighth cranial nerve. Eighth cranial nerve. So that's why it causes hearing loss and balance problem, as it inhibit vestibulocochlear nerve. So the most common and the most important side effect is ototoxicity, and another side effect is it causes nephrotoxicity. It causes acute tubular necrosis. It causes acute tubular necrosis. So, so your serum creatinine level will increase. So another side effect is it causes neuromuscular blockage. Muscular blockage. It is a rare side effect. It is a rare side effect. It causes block or limit the release of acetylcholine at the neuromuscular junction. It can block or limit the release of acetylcholine at neuromuscular junction. So it is also a in pregnancy. It is a class in pregnancy. It is a class D drug because there is reports of renal and ototoxicity in the fetus. Ototoxicity in fetus. So so these are all about aminoglycoside. Thank you.